All right. Thank you so much for joining us today, Dr. Ragsdale. And I actually just read your post that you sent to me, and the work that you all are doing is so impressive and phenomenal. I was blown away. And Patty had I know Patty had mentioned you to recommend in the first place. And then actually reading the article and seeing all that you've been doing was so impressive. So I guess my first question is just if you could kind of explain, in plain words, what you guys do at the clinic.
Yeah, thank you, Stephanie. I mean, what a pleasure to be on with you both today. This has been such an exciting team effort. I'll tell you that much. This has not just been from me, really an interdisciplinary group of people got together to start our pediatric vaccine clinic. So this started, I think, our planning the end of September, beginning of October of last year. When we knew the FDA and CDC was getting close to approving a vaccine, this was in the middle of one of our largest surges of COVID-19 for kids. It really walloped a lot of communities and a lot of kids were getting sick. So very scary time for caregivers and parents and families. This is the thing. We really wanted to be intentional about how we go about giving vaccines. We didn't want to just have kids come in a line, sit them down in a chair, give them the shot and say, okay, next. That is just really not what we wanted our approach to be. And I think for a couple of really important reasons. Really, we wanted to be thoughtful about what kids had been through in the past 2 years. Their whole lives have been upended, and tons of kids have been affected by having a loved one die from COVID. So you have the fear of COVID vaccine, you're getting a shot, you have the worry about getting sick, you're going to, you're in this mass vaccine area. There's a lot of anxiety, rightfully so, from kids and from their families. So really, we took what I would consider a trauma-informed care model. So this kind of thought and process we had already rolled out in our children's hospital. This is a way that healthcare providers even can be thoughtful about what are families coming to the health system, bringing along with them, the experiences in their lives, different experiences with health systems, maybe some bias in the system, all kinds of things that you bring along with you as a patient. And then me as a healthcare provider, I also have my own experiences. And so how do we see each other and work together where we're really attending to what past traumas can be? So that's what we call trauma-informed care. So we took that kind of approach. And from the very get-go, where I first walked into a cubicle, office, and they were like, okay, this is where you're going to make a vaccine clinic. I was like, okay, this has to be done different. We can't just sit kids down in a chair and give them a shot and tell them to get on the way.
And so I love the thoughtfulness that went into that. And the other thing that's really impressive to me is how you've made it in a lot of ways fun.
Yes.
So can you describe some of the different strategies that you're using to actually make it more friendly to kids?
Absolutely. I think fun is something that kids get instantly. They're already coming for a shot. They probably some of them didn't even know they were coming for a shot, to be honest. It was like a surprise. But the minute that they walked into our vaccine clinic, we were like, hey, you're going to go on a treasure hunt today. And to watch kids totally transform what they thought was going to happen the minute they walked in, it was amazing. Their body language changed, their parents' body's language changed, a little bit of a sigh of relief to be like, oh, this is going to be fun. And it's not just fun. It's actually, how do we engage kids in a way that developmentally makes sense to them, that you're thinking about as a 7-year-old, how do we talk to them about what's going to happen to their body? Instead of just saying, don't ask you questions, stand in line, give you a shot. We're going to say, you're going to be part of this. And I think that piece is so important, to engage the child in the process instead of just doing things to them, doing it with them. This is such an important part of them learning to take care of their bodies over time, because kids grow up to be adults. And we want adults to also take care of their body and to seek healthcare and not be afraid. So if we can start really early, and this is kind of the pediatrician in me, if we can start really early and teaching kids that it is fun sometimes to even come to the doctor, or it cannot be so scary to do things that are good for your health. So that engagement fun piece really had thought behind it. How do we engage them and really on their level where they can put stickers down, they know what's going to happen next, there's a prize at the end. All of this was really well thought out. Our child life specialists were so creative in how can we use kids' imagination and their developmental phases to our benefit. Like, how can we engage them in a way that makes sense?
Absolutely. And I think that fun resonates really with everyone, but we especially use that with kids. And Patty, I was wondering if you wanted to address that at all from kind of the parent perspective going through.
Well, I think that, that is absolutely what we experienced, because from the moment you walked in, everything was very streamlined. And so the register, from getting the treasure map to the check-in process was even very streamlined. And then being in the cubicles, I think really helped. So there wasn't that, need to get out as soon as we were finished. If you needed to take a couple extra minutes just to settle your body down, it was fine because that space wasn't going to be needed for the next child. And so because, using that space, I think was just a phenomenal. And really it was every single point that you were, that someone from the clinic, touched you, it was, really well thought out. And then you also knew when the end was. And I think that part is really important, because you need to know that you're not going to be here for the next hour and a half. There is a definite ending. And it was very clear for especially my daughter, okay, this step's next, and then we're done. And that was really helpful.
I like that you point that out, because I think that's a strategy we use a lot also with students with disabilities, where, you give those social stories and you map out what transitions so that people know what's coming next and they know when the end is happening. And I know that on that note, you guys have done some work too to make your clinic sensory friendly. And so I wanted to find out what kind of strategies you've found really effective for that.
Yeah, absolutely. We wanted to be able to have facilities created where we can attend to any child that needs us. So whether that is a physical disability or challenges with body calming or coping during a stressful interaction, we wanted to make sure that we are attending to all of those kids. We wanted to be really the site locally for kids to get vaccines. There was one room that was someone's office with glass windows. I guess it was the corner office. And, the idea was to have something where we can have quieter space, where it's more dedicated space, not just a curtain, but a door, where we could have a calming environment, where maybe a child with open spaces, it's hard for them to have almost too much room. How can we confine it a little bit, use all of our sensories, whether it's smell and sound and lights and touch? That is actually really helpful for kids' brains to be focusing on other things while we're talking about something, and it gives them something to do. But also it's a way for families to interact with a child in a way that is meaningful for them. We can develop plans that say, okay, we know that a child might need a little bit more support when they come. These are the things that we're going to already map out for them. They're going to come we're going to pre-register them. They're going to come straight to the sensory room. These are the things that we're going to do. We had weighted blankets if we needed, bubble sensory machines, things that they could step on the floor, like tiles that have this squishy kind of different colors, and you can mix and stomp on them. So these are all ways that kids can use their bodies to calm their nervous system, use the power of kind of distraction to think about other things if that's helpful for them. Books, squishy sensory devices. Really, we can develop plans that makes sense for an individual child. And I think that's really the important thing, listening to caregivers to say, what's worked? You guys know your child better, so tell us what's helpful. That piece of really listening and trying to make sure that we're giving vaccines in a safe way, because it's a needle, right? So we need to be careful about how we position, but how to really get caregivers involved in the process and the child in a way that makes sense to them.
That's fantastic. And I'm wondering on that note, what recommendations you might give to other clinicians who might want to follow this model? Like, what would kind of be your top recommendations for them to do in order to do that?
You know, this is so interesting. When we stood at the vaccine clinic, I didn't know what was going to happen afterwards. I think the thing that I didn't anticipate was all of the primary care doctors or specialty clinics reaching out to say, we've heard about your vaccine clinic. You're doing really cool things. Can we also have sensory rooms? And I know some clinics already have that, but it's actually pretty easy to do. You can buy things that are sustainable at low cost, and train your staff about how to ask. I think that's the first thing. What do you think would be helpful for your child if we're doing X thing? And it can even be routine vaccinations. If you're thinking about from an infant, we give multiple vaccines if that's the care plan they're on. How do we think about that once a child is able to recognize, okay, this is coming, and really be thoughtful about that so that we're not doing harm or adding more trauma to something we're actually trying to help them with, help their health. So we have been asked to really spread this idea of having sensory capabilities in our clinics, which I think should really become a standard approach for pediatrics.
That's so cool. And I'm so glad you've had that level of interest where people have been asking, and we're happy to further share that in the groups that we interact with. I'm wondering too, what parents might be able to do before coming to the clinic to prepare ahead of time, to prepare their kids ahead of time.
Yeah, absolutely. You know, part of our plan was to make a kind of coping guide for caregivers. I think really mapping out a plan, especially if you know your child has needle phobia or you know, some struggles with body posture and maintaining calmness, to already have mapped out a plan to be thoughtful about that. There are items that parents can or caregivers can purchase if they want. There's kind of shock blockers, and we had a vibratory device called a Buzzy Bee but there's other brands that actually can help block some of the nerve impulses from the sharpness. There's spray that we use. Some kids called it like a Olaf spray, or that they made all kinds of fun names for it, but it's just a cooling spray that can give you just a few seconds of numbness at the skin area before the shot goes in. And these are things that you can actually request from your doctor's office if they have them, or that maybe they consider thinking about this. I think it's really kind of a shift in our approach, I think, in pediatrics, to be thoughtful about what kids are going through as we're helping them with their health and really engaging them in the process, especially vaccines. I think this is a great way for us to help prevent infection. I mean, that's really what we're after. We have lots of vaccines that have been highly effective. And I think COVID vaccinations are ways that we can really prevent severe infection. And so it is effective for that, and something to think about.
Yeah. And I think that I think it helps too sometimes to have, I think those are all such great suggestions. And we've also worked in our center in creating social stories that explain, you know, what's involved with getting a vaccine, and also why, you know, that it helps you to get to, you know, hopefully you're not going to get sick, and it's going to help you help prevent you from getting sick or sick as severely as you might otherwise. So yeah, I think in understanding some of that for some of the older kids can also be helpful. And then I'm wondering as well, I mean, we also know that there's some people, parents, especially with kids, who experience some vaccine hesitancy, maybe kind of nervous about how vaccines might be developed. How do you help address some of those concerns that the families might have?
Yeah, absolutely. I am not scared of those questions. I feel like families that are asking questions are ones that are really trying to be well informed. We shouldn't be afraid in medicine of people saying, but tell me more about this. Like, I really want to know the details. We should encourage that conversation. I will say for the development of these vaccines have been done in such a thoughtful way. Have they been done in a thoughtful way in a compressed timeline? Yes, rightfully so, because we were in the middle of a pandemic. But actually, the amount of patients that we had in the trials for pediatric vaccines have been extremely high. So the amount of patients that have gotten the vaccine prior to approval have been really significantly high. So when we're looking at safety and efficacy data, these have been really well thought out. Prior to kids getting any of the vaccines, millions of adults had gotten the vaccines as well. So we had the benefit of watching what a full population of adult side effects look like. And these were reduced doses for pediatric patients. So looking at the data, really well tolerated vaccines. Probably kids tolerate the vaccine better than adults did as far as side effects, about just feeling kind of not so great the next day or having arm pain. But kids have actually done remarkably well. They are continuing to monitor all of that data on an ongoing basis. So I think that we can feel comfortable that it's not just we made this vaccine and they pushed it through real quick and we're not looking at it anymore. They're actually continually looking at the data and really making sure about safety and efficacy. But the data looks really good so far.
Yeah, and I appreciate you sharing that, because I kind of experienced it on the other end, where my daughter participated in the clinical trials for children as a 14-year-old a year ago. And I was so impressed with the process where they were enrolling people from all over the country, and they were making sure that they had, racially diverse representation, kids of all ages. And when she went in, it was a really good lesson in science for her to understand what a randomized control trial was, and the fact that there's a control group and there's a test group, and she ended up being in the placebo group. But it was, she ended up taking, I guess it's been longer than a year, because she ended up taking AP biology her freshman year of high school, following being part of that trial. And that's a lot of what they cover in biology, and understanding, oh, I was in this control group. And that's why it's, they do it this way so that they can see if there are side effects, and they can see if it's effective in preventing illness. And it was a really educational experience. And I was impressed with the number that were involved and the breadth of it. So I appreciate you sharing that too, from your side as a physician.
Absolutely. What a great learning experience, I think, to see even what a randomized controlled trial feels like you, as a participant. I think that the thoughtfulness about safety and looking at when the CDC and FDA press go, and you can even see with the younger age range, they kept saying, nope, we want more data. Let's wait. We are not going to roll this out until we have good data. And that's what they did, just making sure they have a good enough number to see all the side effects they need to see. So especially with the younger age ranges, being very thoughtful and very careful about it. I was really impressed with the thoroughness.
Yeah, absolutely. And that just reminds me, as we were going through it at first, so her motivation largely to be involved was because she has a brother with Down syndrome who was at higher risk. And so she wanted to try to do something that she thought would make the world safer for him, with the development of the vaccines. And I remember she was getting kind of frustrated when it didn't come out as soon as she thought that it would, because her participation ended and she thought, oh, yeah, it's going to be approved fast. And it took longer because, like you said, they were continuing to collect those data. And they collect information about a lot of things you might not even anticipate. Like she had a little app where she had to report any side effects, and they would regularly follow up with phone calls. And then they also did blood work. And she got to where she was really good at knowing, oh, I've got to drink water a day ahead of time so that my blood, my blood work goes really smoothly and stuff. And so I think sometimes people don't realize all these little heroes that were behind the development of these vaccines too. So they learn a lot in that process as well. I guess I just want to kind of end with, first of all, a huge thank you to you for being so innovative and making sure that this is trauma-informed care and making sure the kids are comfortable and even making it fun. I just want to know if you had any kind of final parting thoughts that you would like people to know as they're going in either for vaccines or as clinicians setting up vaccine clinics.
Yeah, I think two things really. One is for families. I think really ask your trusted provider whether or not, what about the data? What about your child? Really have that conversation openly. I think, our job as parents and caregivers is to protect our kids. And some of that is asking the good questions, like you want to know. So don't be afraid to ask. That's what we should be doing, and having a really open conversation. I think there is good data out there for protection against severe infection for COVID-19. I hope that over time we can talk less about COVID-19 and that this becomes less of a thing. However, I would say that vaccinations is really part of a way we can protect from lots of different things. Polio, measles, all the things that are in the news every day. You feel like you turn around twice and there's something new. So I don't know that this idea of how we protect kids is going away. This is something we should really wrestle with and talk about as a society and as caregivers. There'll be something else. And so we need to be prepared to have open and honest conversations about what's the best thing for our child. I think for clinicians that are going to set up a vaccine site or some kind of health system site for kids is, one, make sure you have experts in the field and an interdisciplinary team, and really listen to experts. It would have been different if I'd come in and said, okay, we're doing this. We're just going to do it the quickest we can and really stream. That actually doesn't create an innovative, patient-centric experience. And so we really have to engage a lot of different stakeholders. Child life therapy specialists are around. There's developmental specialists you can ask, making sure that you're not just thinking about one type of child. Like, you are looking at a breadth of needs, and we need to really be able to respond to that when you're serving the community. And so making sure we're thinking about what the child goes through. And then you need people that are experts in helping us make sure that the operational plan really addresses those needs. And make it fun. Why not? I think a lot of the adults came in, were like, can I have a treasure map? And can I get this breezy spray? And we're like, absolutely. Maybe we should be doing this for adults too. Maybe we would seek care if it didn't hurt and it wasn't so painful. I think these are all things to consider. I think, why not? We should be doing those.
Thank you so much. And Patty, did you have any parting thoughts or? All right. So Dr. Ragsdale, I also just wanted to follow up with one other question. For those of us who have gotten our kids vaccinated, is it time now to get boosted? And if, for example, they had COVID over the summer or have contracted it at some point, do they also still need to get boosted?
Yeah. Oh, such great questions. So yes, it's time to get boosted. I think especially with school starting and activities ramping back up, I think that is where we're seeing some of the community spread. So really your initial vaccines and your booster give you the best protection. If someone has had COVID in the meantime, I think that a COVID infection really stimulates your immune system in a certain way and only lasts a short period of time. But the vaccination can stimulate your immune system in a different way, and that can actually last and protect you longer. So I would still recommend a COVID booster. if you just have to wait until your symptoms are gone. So if you have a COVID infection, make sure that you're all, healed up and better. And then you're eligible for a booster, which will protect you longer. I do anticipate over time that the vaccine will be changed so that whatever the current strain is, the current variant, it'll be included over time, but still a very effective booster even now, and effective against the strains that are going around the community.
That's really helpful to know. And you actually answered my second question too, because I was like, is there any kind of waiting period? So basically it's just wait until the symptoms are gone.
That's correct.
Okay. Well, thank you so much for joining us today. This was so great, and we're excited to share.
Oh, thank you so much. What a pleasure. And thank you for highlighting this important need. And thank you for all that you both do. I'm such an important job. So thank you.